Hello, I am Dr. S.S. Gambhir, Senior Consultant Plastic Surgeon, Sir Gangaram Hospital. This is one of my teaching video regarding hair transplant. In this video, I'll be talking about what you need to know about hair transplant as a whole from day 1 to nearly 10 months of time since you see the results. The first of all that is required is the consultation. Once we see the patient, we decide the number of hairs that are required, we decide the density, how much density is to be placed, then we check for the fitness of the patient, whether it's fit for the surgery or not. What are grafts? These are basically follicular units. The number of hairs growing from one single point. They are grown in a form of bunch. 1, 2, 3, 4, 5 depending on individual patient and depending on his ethnicity, depending on his culture, the grafts are there. In medical term it is called follicular units, in layman term it is called grafts. Now you see this patient, the area which is bought the frontal area, and you see the donor site is good, the quality of hairs are good, they are thick coarse hairs. Before surgery the marking is done, the whole head is then shaved. You see this patient, the donor site, the number of scars are there which are because of previous injuries. Then the patient is made supine, he is sedated, and the local infiltration done so he doesn't feel any pain. Everything has been done. Then we do the slits depending on the density, the number of slits are being made, the direction are being taken care, the direction of the hair in which they grow in future, or what the patient had or what the patient intended to have. And once all the slits are made, then the patient is made prone, and then we extract the hairs from the occipital area. You see this video, this is under slow motion, the hair being extracted, and simultaneously one of the technician is taking out the hairs with the forceps, and you can see the small punch. The size of the punch is around 0.8 mm, and once the hairs are extracted, simultaneously they are being placed in front by two of the medical staff in the front area. You see the video that they are being played, the density is predefined, the direction is predefined, they just have to fill the slits.
You can see it's a very tedious process. It has to be done one by one. It takes a lot of time and a lot of patience and a lot of training to put this graft. This is immediately after transplant. The close-up view, you can see the density in the close-up view. This is more close-up view. You can see the density, and this is another patient which we have done. The front area has been totally covered, and this patient pre and post.
So immediately after the surgery, you look on the back area, it looks like that number of dots, that is dots, but after 2 days you see the dots are not visible, they are nearly gone, and after 5 days you cannot see from which area we have taken out the graft, and the normal hairs start growing back. Second day you see that the hairs, they have dried out, and then it is slightly blackish in color. Of course, on the second day there is a swelling over the face, which is not found in the video, but swelling. In most of the patient we see the swelling, and it subsides in 6 days of time. Patient, this is after 10 days of surgery. The slight gaps are seen in the transplanted area, and this increase in size over some time. So these gaps do increase. Do not get panicky on that. This is a normal part of hair transplant. And after 15 days you see the hairs density has decreased, the translation is there, you can see in this photograph. Then after 45 days, only 5% of the hairs which have been transplanted remains, rest of them have fallen.
This is after 4 months, you see the result.
And this patient, this is after 6 months, you see the patient, the density is very good even after 6 months of time. On the front area, on the sides, the density is all very good. Now this patient is after 10 months. You see the results. The results are very good. Density is good. The hairs are getting longer, but they are slightly dry. We have to keep them moist with some sort of a serum. This is another patient, and the front view, the side, the lateral view.
Patient is absolutely happy with the result. The density from all the sides, the results, and he is absolutely satisfied.
This is the other patient which we have done from front, side, and lateral view.
You can see the result. The results is very good from all the sides, and the density is absolutely okay, and the patient is absolutely satisfied.
This is another patient. You see the front view with a good density. And if you've got any more queries, you can contact us and look for more videos on hairs. Thank you.